box that you could put those in. So then for sure your questions will go on. I do have the chat available. Last week, I apologize that some questions that came in, I think, on the YouTube chat, I wasn't able to see. So maybe Dustin will forward those to me. So we got several questions that came in, and I want to answer um, a couple from last week that I was not able to see. So first of all, first question: my teenage son has a lot of pain in his feet when he's been on them for an extended period of time. He wears compression socks and has custom orthotics. He's seen a podiatrist, uh, pediatric rheumatoid doctor. MRI shows inflammation in his feet. So I think you're doing the right thing as far as looking for the source of inflammation. Does this person have juvenile rheumatoid? Um, you're always digging to the reason why. So it could be something as simple as fallen arches, needing arch support. When I was in high school, um, I got fitted with these leather type arch supports, which I think the hard arch supports are not good. I think you need a compressible arch support. I think it was a Foot Levelers brand leather arch support. And boy, that made a giant difference in my inflammation in my feet. I was an athlete, and you just put a lot of pressure on my feet. As you get older, you have foot pain because you have other things going on. But uh, as a young adult, you should not. There's a reason why that you have that sort of foot pain, that you feel like you have to wear some sort of um, uh, compression socks or something. So digging in to find out what that could be, looking for autoimmune issues, rheumatoid arthritis, gouty arthritis, different things like that. You just got to keep digging until you figure that out. Um, I can't really give you a whole lot more information without seeing more details on his history. I wish I could. Now, there's just too many possibilities just with that data. Next question. I was using a glutathione supplement in coffee enemas before I got a diagnosis of cancer. Is it possible that glutathione caused my cancer? I have been sugar and grain free for 20 years, also totally organic diet for 40 years, and keto low carb diet with consistency of daily fasting. Um, can glutathione cause cancer? Well, for most people who don't understand that connection, that would be counterintuitive. Glutathione is an antioxidant, and glutathione helps prevent cancer because most cancers are caused from some sort of toxin or oxidizing agent that's getting inside the cell and damaging the nucleus. So remember, cancer is a cell that something got inside that cell and damaged the nucleus. So the nucleus is now in a state of rapid replication. That's what the definition of cancer is. And it's replicating cells that are in a state of replication. Now, the reason why this person asked about glutathione and cancer is that I am one of those doctors who advocates against using glutathione once a person has a diagnosis of cancer. And the reason why I would say glutathione is counter uh, contradictive of for a person with a cancer diagnosis is that cancer cells, because they're already rapidly replicating, are already producing a lot of oxidative stress. So they're at that near lethal dose of oxidative stress, and um, by using glutathione, which is an antioxidant, you're basically helping to keep a cancer cell alive. Now, I would not say that glutathione causes cancer. So, to answer this person's question, is it possible that using glutathione in my coffee enemas before my cancer diagnosis would be a cause of my cancer? I would say absolutely not. Glutathione is something that I would recommend somebody who knows they do not have a diagnosis of cancer We are exposed to oxidizing agents, you know, at a rate that is maybe 100 times greater than our ancestors. And we need support for glutathione. Glutathione is your main intracellular antioxidant. It's helping get rid of those damaging reactive oxygen and reactive nitrogen species that develop in the presence of both pathogens developing in our body and in the presence of chemical toxins. So using glutathione helps decrease the chance of a person getting cancer. But however, once you have cancer, you could actually be helping the cancer stay alive. So if you have a diagnosis of cancer, then many of the treatments, certainly standards of care treatment, chemotherapy is an oxidizing agent. And it works to kill cancer because cancer cells in a state of rapid replication are producing a lot more reactive oxygen species. They're at a state nearer a lethal dose of oxidation. And you giving an extra little boost of oxidation, aka chemotherapy, you can help kill the cancer. So that's why cancer cells die first with chemotherapy. Chemotherapy can damage other cells, though. That's the negative of it. But cancer cells are nearer their lethal dose of oxidative stress already, so giving them a little more oxidative stress will help kill cancer cells. So I wouldn't use glutathione once you have cancer, but it certainly is not a cause of cancer. Okay, next question. What to do when you have a conflicting genetic defect? That is, COMT defects with MTRR defects. COMT genes help produce multiple things, but they function in the myopterin pathway, and they help with neurotransmitter function. The MTR and the MTRR genes are in the vitamin B12 cobalamin pathway, in the methionine pathway. For one, you should take hydroxycobalamin and the other methylcobalamin. Thanks. Well, first of all, I don't treat genetic defects. You don't go, okay, you have a COMT gene defect, so you should be on this, or you have a MTRR, you should have to be on this. You have to look at it in the big picture of everything else that's going on with that patient. So your genetic picture is just one piece of that puzzle. I would be careful with methylcobalamin with anybody, because if you have a lot of other defects in the myopterin pathway, excess methyl groups are going to push that pathway. And it's very common that a person ends up with excess serotonin because they were diagnosed. Some doctor did a genetic test on them. They had MTR or MTRR gene defects, or they had MTHFR defects, your methyl tetrahydrofolate gene. And then they were given a methylfolate or methylcobalamin, thinking that, oh, well, you have an issue with decreased methylation, so you need to be on some methyl groups. They're given those methyl groups without really looking at the patient's big picture. Where are their neurotransmitters at? Are there other defects in the myopterin pathway that would suggest that excess methyl groups would be not a good idea? I see that quite commonly. So then these people are given methyl groups because, oh my goodness, you have an MTHFR defect, so you need methyl groups. No, you don't. So that's not the way to care for somebody, is to treat them from a genetic standpoint alone. You have to look at the big picture. Furthermore, if a person has, a perfect example is a person has a diagnosis of cancer and you're giving them methyl groups. One of the things methyl groups do is they silence genes. They turn off genes. And excess methyl groups can turn off tumor suppressor genes. So if a person does have cancer, you are dependent upon your tumor suppressor genes to stimulate the intrinsic apoptotic pathway to kill cancer cells. And if you're taking excess methyl groups, you're basically silencing that pathway. You could turn off that pathway. So if a person has cancer, I don't want them on any methyl groups unless a bigger picture tells us to do so. If they have issues with homocysteine or something like that, then we'll put them on methyl groups for a period of time. So again, you don't just treat one thing. You don't look at even one lab and treat based upon that one lab. You got to look at the patient's big picture. What is their other diagnoses? What are their other issues? What are their other lab findings? So to answer your question, you don't treat a genetic defect. You have to look at the big picture. Next question. My son has a rare autoimmune disorder, pyoderma gangrenosum. He has been under care of a team of doctors in St. Louis University. Okay. High-dose prednisone almost killed him. They wanted him on immunosuppressants. Let's stop right there. So yes, if a person has an autoimmune disease from a medical standpoint, especially if they're in an acute flare, they're going to put them on an anti-inflammatory immunosuppressant, because an autoimmune disease, when it's in its acute flare, is in a hyper Th1 response. So a prednisone, a steroid, is going to calm that down. The problem is people can react aberrantly to steroids. So in this case, it was a grave aberrant reaction to prednisone that this person said almost killed him. They want him on immunosuppressants. That would be the medical treatment for an autoimmune disease. Try to suppress the immune system. We do not want to go this route. We're using holistic plant-based treatments but need more help. It's terrifying. He's only 37. He needs his life back. Thank you in advance. So first of all, that's the medical route. How to treat an autoimmune disease is to use immune suppressants. It actually will, in many cases, decrease the person's symptoms. The problem is it does nothing to address the problem. So I'm going to highly recommend anybody with an autoimmune disease, and this person, if they're listening to their question being answered, to go and join our chronic disease and autoimmune course. Because I go into great detail about what to do with an autoimmune disease. First of all, so an autoimmune disease is when your body starts making antibodies against its own tissue. If you're starting to make antibodies against cells in the skin or the subcutaneous layer of the skin, that's a type of autoimmune disease that is a pyoderma autoimmune disease. It's a rare disease. I had to look it up when I saw this question. It creates boils and stuff on the skin, and it's you can create antibodies to any tissue, any cell line in your body, and that's what an autoimmune disease is. Why is it there? So first of all, that's a good thing to look for. Does the person have some sort of toxicity, heavy metal toxicity, that caused the body to end up creating antibodies against self tissue? Many times when either a toxin or a biotoxin is in the body and it goes intracellular, inside the cell, the immune system is going to fire to try to kill it. Aberrantly, if it's a toxin, because toxin can't die. Normally, if it's a biotoxin, because that's what the immune system is supposed to do, is kill biotoxin, but if it goes inside the cell, your immune system can't kill it. And if it's firing a Th1, Th2 response multiple times, the Th2 response is the B cell response that then creates antibodies. It's supposed to create antibodies against the infection, let's say strep or something like that. But if this thing keeps going inside the cell, or if this toxin is inside the cell and the immune system is aberrantly seeing a toxin as something it needs to kill, it can create antibodies to that cell line where it's found. So finding out what the cause of this is can be helpful, because you can help detox that and help calm that down. More importantly, you have to find out what the person's triggers are. So anything that will trigger an immune response is going to make the damage to whatever tissue that that person has antibodies against, aka the type of autoimmune disease, it's going to cause that to flare. So if a person says, I have this pyoderma autoimmune disease and it keeps flaring and it's so bad, it's horrible, you got to find out what other triggers are stimulating the person's immune response. Or you're just going to go a medical route, you're just going to do an immune suppressant. That's just, to me, that will help in an acute situation, but that's not the long term way to treat an autoimmune disease. You have to find out the cause, you have to find out what the triggers are, and there's ways to test for this. And I go into exhausting detail on that course. So if you don't test for and find out what your triggers are, you're just committed to just having, just constant flares of this disease and a horrible life. You can find out what those triggers are. You can calm those down wherever this is. I've had patients with MS, antibodies to myelin sheath cells. If you find out what your triggers are and you can calm down that immune response, then you can work on some natural anti-inflammatory things, and you can really help get that person's life back under control. Now, this person says we are doing a holistic plant-based treatment. Well, I would caution you highly that, what are those holistic plant-based treatments? If you're doing herbals that are stimulating an immune response, you're making the person worse. So if you're doing any type of natural care with an autoimmune disease that is stimulating an immune response, you're making the person worse. Perfect example is a person like I have chronic Lyme. Well, it's really not chronic Lyme, they have autoimmune disease now, and that's what their symptoms are. And they keep taking, cat's claw or some immune stimulant. Now I'm taking this. Now I'm doing this astragalus protocol for Lyme. This is just absolutely the wrong thing to do. You can't be doing immune stimulants when you have self antibodies. I've said this a million times. Once you have self antibodies and you stimulate the immune response from any source, you are going to kill that which you have antibodies against self. That means you're going to kill self tissue. You're going to cause a flare. So take vitamin C, it's an immune stimulant, you're going to cause a flare. You take garlic, it's an immune stimulant, you're going to cause a flare. You take astragalus, you take echinacea, you're going to cause a flare. Well, I'm trying to kill the bacteria, or I'm trying to kill the Lyme, I'm trying to kill this, or my natural doctor said to do this. A lot of doctors, whether they're natural or not natural doctors, don't understand an autoimmune disease. So highly suggest you take that course. We have doctors taking that course. $50. That will help. You'll learn something. You can set up a case review with me if you want to, through the course or through our website. Okay, next question. What can I do to help with high cholesterol? My doctor wants me to go on statins. So it depends on what you define high cholesterol. So when I graduated from school, 220 and above, I think it was 220 and above was considered high. Then they dropped it down to 200 and above was considered high. Now I think it's 180 and above is considered high. Why? Because they can sell more statins. I'm sorry, but that sounds really mean, but it's true. So that's the reason why they do it. High cholesterol by itself is not going to be arterial damaging. It's when you have high cholesterol with damaged or etched arteries, that the arteries are going to become plaqued with that cholesterol. Always with high cholesterol, you always want to find out why. Now, there's some people with high cholesterol that have a familial congenital condition of hypercholesterolemia that no matter what you do, even taking statins, you're not going to really get them even close to normal ranges. And there are some people with cholesterol over 300 that have had cholesterol over 300 that have no known familial condition of high cholesterol, and they're in their 60s or 70s, and they've had this their whole life, and have had scans of their heart and have no cholesterol plaquing. Well, what's the deal with that? because it's not high cholesterol alone that causes arterial sclerosis. It is high cholesterol with an inflammatory condition tied to the endothelial cells, which are the cells that line the arteries. So endothelial condition is what is really causing the problems, not the high cholesterol by itself. Now, I've had people with cholesterol of 225 and their doctor is putting heavy pressure on them to go on statins. Well, you need to educate yourself and fight back against that. I would not do that if it was me. So, but again, you don't just look at cholesterol. So again, you don't just look at one test. Plus, you should break down the cholesterols. If you're going to do a proper blood test for inflammatory markers that are tied to fats and tied to inflammation in the endothelial cells, you need to break down the cholesterols into the different densities of LDLs and oxidized LDLs, and you need to do a more comprehensive blood test before you start thinking about going on statins. So I'm not against using medications when it's the right thing to do, but I'm very against using medications just to alter a blood test, because a person can have low cholesterol. I'll tell you, my dad was a perfect example of that. He had low cholesterol and had a heart attack, had to have triple bypass surgery. Well, how did that happen? He has low cholesterol, because cholesterol is not the issue. That is not the problem. It's inflammation of the endocardial tissue. And the most common causes of endocardial and endothelial inflammation is H. pylori, chronic Lyme, heavy metal toxicity. There's a couple other ones. But you got to dig into that and find that source of that. So very, very important. Next question. My dad has sepsis, close call, but back at home. Tons, way too many in my opinion, of antibiotics. He has a urinary tract infection that he can't get rid of, along with a catheter still. It's been over a month now. What would you recommend from your clinic? Thanks so much. Have a blessed day. Okay, so a person with urinary tract infection, sepsis, if that's an infection that's carried in the blood, that can be deadly. What do you do? Okay, it's like, what's your protocol for this? Well, you got to dig to figure out what this is. First of all, did they test the blood? Did they do a culture? Did they find out what the infection was? Did they do a culture of a urine culture to see what the infection in the urinary tract is? Because that's going to depend on how you would actually treat it. If he's been on a ton of antibiotics, then maybe it's not a bacteria, or it was the wrong antibiotic for the bacteria, or they didn't culture to find out what the bacteria is, to find out what the antibiotic should be. Again, we see this all the time. I just had a conversation with a gentleman that had blood work done in May or in March, had elevated white blood cell count, definitely to the level where he had a current infection, elevated neutrophils, which would suggest most likely a bacterial infection. And I didn't order the labs. His VA doctor did, ordered those labs, didn't do anything about it. Didn't tell him that there was an infection, didn't tell him that we need to treat it. And then went back in again at the end of April. They didn't even rerun the labs. I just don't get it. Why do you run the labs if you don't do anything with them? Especially when there's positive findings and you do nothing with them. Why did you run the labs again? Or you put this person on some type of protocol and then you don't retest to see if you actually fixed it. I'm sorry. I'm just at a loss for words. Here, these medical doctors have these multi-billion-dollar complexes where they can run CTs, MRIs, blood work at within a couple hours, get the results back, and then they don't know, either don't read them, don't know how to read them, don't do anything with them, and don't retest. I'm sorry. I'm on a little frustration wagon here, because I don't have those wonderful tools at my disposal where I could get blood work back within a couple hours and try to help the patient. And they do, and they don't do anything with it. So From a general nutritional standpoint, without knowing any more data, if I could help this person, if a person has a urinary tract infection that doesn't go away, if they have an infection in their bladder, one product that we use in our office is an herbal product called Barosma Complex because it has couch grass in it, it has licorice in it, has echinacea in it, and buchu in it, which is really good for the urinary tract. Another product would be D-mannose, um, which is a sugar that actually is really good for UTIs. But I'm not telling you to take that. Those would just be things that would be general recommendations with UTIs. Okay, another question that just came in. Hi, Dr. Connors. I'm 67-year-old female. I was diagnosed with an enlarged bladder. I have no pain. They did diagnostic testing and determined I do not have urine retention. They told me I must have had urine retention in the past. My bladder size is greater than 1,000 milliliters. I went to an alternative doctor and he suggested it was estrogen dominance. He wants me to apply a tablespoon of Progest E, a brand name, every night for 2 weeks out of the month. The theory is that if I apply it every day of the month, my liver will start canceling it out. What do you think, and what would you do in my case? I take thyroid meds, but I'm otherwise healthy. So I don't know if this alternative doctor is just following a protocol that they've used in the past, that they've had success with in the past. Um, I don't know that. In order to find out if you have estrogen dominance, you should test. Um, a Dutch test is probably the best test on the market right now. Dutch test is a dried urine hormone test, um, and they test for all the estrogen metabolites and progesterone and androgen metabolites as well, and you can see if you have estrogen dominance or not. Also test for cortisol levels. So ordering the Dutch test, I think, would be the right thing to do. So, um, and then you'll know. Is there any harm in taking progesterone? That's what that product, I believe, is. It's a topical progesterone. Is there any harm in taking that? Probably not. Um, so if you have confidence in that doctor and the way that that doctor, he or she tested, or I don't think that there's necessarily any harm in doing that with somebody your age. Um, most people have low progesterone at 67 years old. I don't think there's harm in doing that. But I do think it's wise to get tested. So if that doctor won't test, you can order tests if you're a course member. I don't know if this person is one of our course members, but if you are on our chronic disease autoimmune course or any of our other courses, you can run labs through them, and it would be the Dutch complete test that I would recommend. Okay, so remember to go to the holistichealthhour.com if you want to post a question. You can post a question on the chat as well. A couple other questions from a few weeks ago that I was not able to get to. One is, why do so many people say to drink apple cider vinegar? I see so many posts on Instagram about apple cider vinegar. What would be the rationale? Okay, so apple cider vinegar is a mild acid. It's acetic acid. So um, why would you take apple cider vinegar? Well, your stomach has to have a pH that's relatively very acidic. So your stomach pH is at about 1.5 to 2.0. That's very acidic. The acid that creates the acidic environment in the stomach is hydrochloric acid, produced by these cells in the stomach called these parietal cells in the stomach. And you need to have that level of acidity in your stomach for multiple reasons. That's how you break down proteins and carbohydrates in the stomach, where you start the process of digestion, that is breaking down food. into small particles so that you can absorb them. That, coupled with the ptyalin that's secreted by your salivary gland, HCl, that's in the stomach, combines in the duodenum once that bolus of food goes into the small intestine, um, more partially digested, combines in the duodenum with the enzymes secreted from the pancreas, and then combines with the bile, which helps break down fat and get rid of toxins from the gallbladder, from the liver. So you need an acidic stomach. And one could argue that the lack of acidity in your stomach mainly caused from a lack of production of hydrochloric acid by the parietal cells, mainly because of poor diet, chemicals, toxins, dyes, additives, colorings, flavorings, poisons, toxins, GMO foods, etc., damage those parietal cells so you don't get enough production of HCl. So then your stomach is relatively alkaline, food is not getting digested, worse things happen. You don't secrete intrinsic factor necessary for vitamin B12 absorption. So that whole condition is called hypochlorhydria, decreased hydrochloric acid in the stomach. That's what leads to leaky gut issues because you are not getting food properly digested, broken down, putting a lot more stress on the pancreas. One theory why the increase in pancreatic cancer exists, an enlargement of pancreas overall, and pancreatitis, also an increased stress on the liver and gallbladder. So food is not getting broken down into its proper size molecules. So proteins are not getting broken down into dipeptides or amino acids. They go into the small intestine and into the large intestine as larger peptides and can damage the gut walls, along with all sorts of toxins and GMO foods that you ate that damage the gut wall. Now they can cross the gut border as larger peptides. You develop antibodies against different foods. Now you have food sensitivities. Every time you eat those foods now, you develop an inflammatory reaction in the gut, and that inflammatory reaction in the gut causes further degradation of the epithelial layer of the gut, damaging more gut cells, increasing leaky gut issues. It's just a giant ball of wax problem. So you could solve a lot of problems by taking HCl and digestive enzymes with each meal. Or if your stomach can't tolerate that because you've had this damage for so long, many times you also have an ulcer. So you can't even take HCl because it causes such very strong stabbing stomach ache. You can start with apple cider vinegar and see if, since that's a little bit milder acid, and see if you can tolerate that. If you can't tolerate that, you have to go back and just try to heal the gut, heal the stomach with something like deglycerized licorice. Now I have a blog post on this, so if you go to our website, connorsclinic.com, you'll see a blog post that goes through all the different steps about this. And just search hypochlorhydria or HCl, hypochlorhydria, something like that. Search for HCl stomach issues and you'll find blog posts about this. This ties into the next question that says, can I drink baking soda water to help alkalize myself? Or have had people, since our clinic mainly sees people with cancer, I've had people say I'm drinking high pH water, thinking that's alkalizing yourself, because they are holding to a very incorrect theory that cancer can't grow in an acidic environment, which is just completely non-physiological. So cancer in itself, because it's growing and it's a mass that's in a rapid replication, is created an acidic environment where it's growing. And yes, it would be great to alkalize that environment, but you don't alkalize that environment by drinking alkaline water or drinking baking soda. To anybody that says that is just not understanding basic physiology. These are the things that irk me about Instagram and Facebook and even quote unquote natural practitioners that are making statements that are absurd, that are just physiologically absurd. So I hate to say, there's companies that sell you machines that give you high pH water. There's people that go in the store and you buy a water that's at 9.4 pH, very alkaline. All you're doing is alkalizing your stomach. It's completely counterintuitive. It does not make any sense whatsoever. And you're physiologically damaging your stomach, you're damaging your gut, you're setting yourself up for all sorts of problems, thinking that you're doing something healthy. I mean, the positive of the internet is there's a lot of great stuff, and you could basically get an education without leaving your home. The negative is there's a lot of wrong information, and you could mislead yourself too. So, you not understanding some basic physiology can be a problem. There was a question asked a few weeks ago. Something like my son or my daughter wants to go into naturopathic medicine, natural medicine. What should I do? What school would you push them towards? There's some naturopathic type schools that are online that are teaching information that is just completely wrong. It's sad. It's really sad. And then people are graduating think that they should, do things like this. They're telling people to drink alkaline water, or they're telling people to drink baking soda water, or to test with pH strips, test their saliva or test their urine to see if they're alkaline or acidic. It's just total nonsense. And it just gives natural doctors a bad name when you see this silliness that's out there that is worse than silliness because it can hurt people. So I was kind of at a loss. I was kind of caught offhand with that question because I didn't know how to point people to the right education to take. Now there are some good online courses and online naturopathic schools and stuff to go to. I can't think of any off the top of my head. I'll have to research that a little bit. I would suggest take our courses. I mean, they're $50 for our autoimmune course. I just added 4 videos today onto that course, onto module 3 on that course. That's going to take you several months to get through that. You'll be smarter than most natural doctors by just going through that course. I'm not trying to puff myself up. I've learned from people. I'm standing on other people's shoulders, you want to have a heart that's constantly learning, that knows, because the more you really know, the more you really know how much you don't know, and the more you realize what you need to learn. Somebody just texted me. It's the one naturopathic school is Eden School, New Eden School for Natural Health. That's it. Thank you, guys. New Eden School for Natural Health. I'd recommend that one. That's a good one. But there's another one, Trinity, I would not recommend. There's several online schools I would not recommend. There's a huge benefit to going through chiropractic school or going through a 4-year naturopathic school, and that is that you're going to learn physiology. And that's what you are not going to learn through these online schools, just because they don't have that hefty enough of curriculum. So we have had a couple of our practitioners in the past did the New Eden School, and I think that's the best one that's out there right now. But I did look at the Trinity, and I was just very disappointed with that. So be careful of incorrect information. If you have questions about these things, also remember to go to our website, connorsclinic.com. We have well over 1,000 blogs with a really good search engine. And you can go to that search thing and put in any question you want. Pretty good chance that I did a video or did a talk about it or wrote an article about it. And if I didn't, ask the question on here. So go to our holistichealthhour.com website and ask a question. Okay, I think that is all the questions we have today. We just do a double check. And so make sure you go to holistichealthhour.com also, because all our posts, our past holistic health hours, are indexed. Really nice. Dustin does a great job on that, and gives you topical index so you can go to whatever class you want. You don't have to listen to the whole thing. And if you want to make an appointment, go to connorsclinic.com and you could schedule an appointment or call our office and just ask questions. All right. God bless you all, and we'll see you next week.